Rise of Health Literacy, presented by Annick Gloria. First, the outline. In the outline, we are going to see the explanation of health literacy, factors which affect health literacy, literacy effects on patients' outcomes, health literacy effects on prescription medicine uses, health literacy effects on preventing care, and then you're going to see the reference. We start, here's the explanation of health literacy. Health literacy is the degree at which people are able to obtain, process, and understand basic health information needed to make appropriate health decisions. You can see that health literacy includes numeracy skills, for example, like calculating cholesterol and blood sugars level, and like measuring medications and understanding nutrition levels all require math skills. That's why I say that it includes numeracy skills. So, as indicated by WHO, health literacy has been defined as the cognitive and social skills which determine the motivation and the ability of individuals to gain access to understand and use information in ways which promote and maintain good health. So, this picture shows health literacy about the general public, community-based organizations, educators and health communicators, business community, health care facilities. It means that it's included in health literacy. Going to the systematic factors which affect health literacy, you can see that health literacy affects people's ability like navigate to the health care system, including filling out complex forms and locating providers and services, like share personal information such as health history with providers, engage in self-care and chronic diseases management, and also understand mathematical concepts such as probability and risk. So here are some factors which are like communication between lay people and health professionals, lay and professional knowledge of health topic. You can see there is culture, that's also another factor. There is also healthcare demands and public health systems. Also comes what we call education level. So those are the systematic factors which affect health literacy. Now, let's see health literacy effect on patient outcomes and nutrition. What we're going to see now is about patient outcomes. People with limited health literacy skills are more likely to have various diseases. For example, like chronic diseases and other worse conditions. You can have like a diabetes or cancer because maybe you don't know you don't have any skills about how to know the symptom of that, and then you can get the disease can become like chronic one or can get to a worse condition. And again, lower parental health literacy can result in unhealthy lifestyle and poor health. So, and again, people with inadequate health literacy skills and less knowledge lead to make bad decisions. For instance, a simple example is that health literacy in childhood and adolescence effectively like provides the tools teens need to make informed decision about lifestyle and sexual health. So this demonstrates that when there is a health literacy, it will enable children or the teens and the future adults to achieve their goals, to develop their knowledge and the potential, and also to participate fully in their community and the wide society. So that's how health literacy affects on patient outcomes. The patient nutrition. So health literacy is detrimental for communication between healthcare provider and patient. So if patients aren't understanding the direction given from doctor or nurses or someone else, they can take the appropriate action to improve their health. Let's see. If like this is an example, the patient will convey information that are related to what he wants, and if something gets wrong or they forget the information, they can get something like to refer to. If one of the question nutrition about health literacy that permits people to read the amount of nutrition they take written on the food. For example, you can estimate of the food like the portion size, understanding food labels, and seeking or trusting nutrition sources, all of which affect dietary quality. That's a good thing. And again, health literacy enable people to eat healthy and balanced diet. As an example on the picture, so you can see that she's eating a healthy food. There is protein, vitamins, there is calories, everything. There is everything, protein, everything, which shows that it's a good diet. And again, health literacy help people to know what type of food to avoid depending on their health condition. For example, you have like a diabetes, now that the kind of sugar that you're not going to eat. For instance, if you have like a cancer, now what kind of food you're going to take, not like taking food that contain cholesterol. Now we're going to health literacy effect on prescription medicine uses and preventing care. So now it's about prescription medicine uses. So it is hard for those with limited health literacy skills to follow instruction written on the medicine labels. For instance, now how many like pills is going to take, or dose of medicine that she or someone is going to take. They sometimes don't have the ability to comprehend like prescription medication dosage. As I was saying, they don't know how many dosage I'm going to take or what I'm going to do. It means they lack skills for describing symptoms or using a map to locate health facilities. And again, is that they will now that they will get to know the ability to read and comprehend prescription medication. As I say about this age, they will know about appointment forms, like consent forms, and preparation for diagnostic testing that require like functional health literacy. So it means that if you don't know how to read, all health literacy will affect you because you can know the dosage, you can know where there is the medication, how many like pills you're gonna take, or where there is where the clinic or the hospital is located or health facility is located. Now about preventing care. So due to the health literacy, people will be like familiar with everyday health related words. For instance, they will take different measures to avoid like diseases. That's one of the things, because if you become familiar with different words, you will know like how to avoid diseases. You know that if this food contain cholesterol, maybe you'll know that you're not going to take much cholesterol, because you know that next time it will give you, or it will lead you to a cancer or a given diseases. Or if you know that there is much sugar in this in the given food, you won't take it because you know that it will result in diabetes. So that's why if you know how to prevent, if you know you are health literacy, you could know how to prevent yourself of given diseases. So, due to the health literacy, you have like experience with the type of written material, such as drug labels. Of course, as I said, if you know how to read now, you will not suffer. You will not get problem of saying that you don't know how many like pills you will take or how many dosage you will have. And again, have knowledge. You will get to know to have knowledge of how the healthcare system works. Like in case someone is sick, do you know how to do and where to go? For instance, sometimes when at home we are sick, like we have like a small wound, you know that we're going to take a medicine called Dake, and just it's like an alcohol, just heals on your wound so that it will to remove like bacteria or other infections. So if someone's really have knowledge about healthcare system works now, he will not get any problem about diseases. So people have to practice health. It's like a conclusion about health literacy. It's like people have to practice health action and behavior that contribute to their welfare. So yeah, that's what I was saying. Here is the reference that helped me to come up or to end up with this project. Yeah, so for more information now we can find this is the resource that could help someone. Thank you for your attention.